Welcome and hello. My name is Luiz Diaz. I am the Vice President of the National Student Nursing Association, and I also am the Chair of the Population and Global Health Committee. Within this committee, I also have my cohorts of Kyle Luce and Jalea Townsend, and we welcome the opportunity to discuss what our initiatives are within this committee. We have made a great acronym, E.D.G.E, explain. That is the E part. It's about how we define and explain the objectives of what we want to do and accomplish. The D, demonstrate. We want to demonstrate how nurses can impact and affect change within our communities. The G is guide. We want to guide current and future nurses on how to make these changes. The E is for enable. How can we enable people to move forward with knowledge, empowerment, and courage within their nursing communities? This is needed so much, especially today in the era of the COVID-19. So what are we focusing on? We have 5 resolutions that we wanted to focus on, and they can be summed up into 2. But real quickly, the first one is number 43, which is in support of increasing awareness of the effects of climate change on mental health. Second, homeless youth. Thirdly, the establishment of wellness programs by healthcare institutions to prevent, manage, and educate about obesity among healthcare workers. Fourth, increasing awareness of the relationship between food environment and diabetes in minority and rural communities. And lastly, advocating for heightened awareness of the rising cost of insulin and its effects of consumers. So all of these resolutions, we have tried to embrace them in our goals and our strategic plan, and we have a 3-fold plan. Number 1, promote healthy lifestyles through exercise, nutrition, and healthy habits. Number 2, education and prevention of obesity through diabetes management and insulin education. Thirdly, advocate for mental health normalcy through education and awareness. We want to help you track healthy lifestyles through social media postings and quarterly contests. We will include focusing on Diabetes Month and contribute an article for Imprint and have a diabetic educator or nutritionist speak at one of the conferences. We want to advocate for mental health normalcy through spotlight discussion on NSNA social media platforms and an article in Imprint. We have plans to schedule a social worker to discuss mental health and homelessness in our communities at a future conference. So do you want more information? Here's where you can find it. We have 3 websites here that are resources for our committee. Number 1 is we want you to check out our committee guidelines, and all of these can be found at the nsna.org/guidelines for planning. Second, check out our resource page, again, at nsna.org, and then the Population Global Health Resources. Thirdly, do you want to know how to apply for local and state awards? You can do that at nsnaawards.weebly.com. These are the ways that you can become more active within your communities. So here's another opportunity we want to talk about, which is seed money. The 3M Littman Stethoscope Leadership Development Grant and the Maryland Bagwell Leadership Development Grant. We would like to see an increase in the applications that come for these grants. And if you can say them fast 3 times in a row, you're doing great, because I cannot. You can get more information about these grants at theforevernursing.org. You can get an application, and then you can find out tips and guidance on how you can apply. We want you to think of this as seed money to help your chapter accomplish your goals. So, how will your chapter get involved with the Population Global Health Committee? We want that to be really simple for you. First, make community service easy. This is the easiest and best way to get involved. Create a blood drive or a bone marrow drive at a convention or a chapter within your community or at your school. Focus on the resolutions. Utilize fact sheets and social media. We want you and want to help you keep it as a focus by talking about it a lot. That means talk about it a lot. Use your voice. And all of us, we know how to use our social media. Let us highlight you through social media and awards. And thirdly, apply for the local and state awards. So how do we go about these awards? Let's talk about Population and Global Health Awards. The purpose of the Population and Global Health Award program is to foster development and implementation of community service at the local, state, and national levels, and to educate healthcare consumers about illness prevention, early detection of disease and treatment options, and community awareness about changes in community health. Second, Disaster Preparedness Awards. The committee judges this award based on how a state or school chapter has raised the awareness of its disaster plans or developed plans for individual, school, and community responses. Projects can highlight education presentations, development of school or community awareness projects, or disaster kit preparation. Third, International Photo Contest, which is my favorite because I love to take pictures. The International Photo Submission Contest aims to embody the concept of taking global initiative by documenting a pivotal moment, group or individual, during an international experience abroad and sharing how awareness of the nursing roles in improving global health was or can be enhanced. Lastly, Healthy Lifestyle. Starting in September 2020, which is right next door, this is a quarterly award that tracks healthy lifestyle, and we will have additional information that is forthcoming in the next couple of weeks. So stay tuned in. I really appreciate the time that you gave to me and to listen to the presentation. I hope that you have a great rest of your day. Bye.